Hey, are you dealing with hip pain and you're wondering if you have hip arthritis or if you just strained some hip muscles? In this video today, I'm gonna go over some tests that you can do on your own at home so that you can tell the difference between a hip strain and hip arthritis. My name is Dr. David Midoff and I'm a specialist physical therapist at El Paso Manual Physical Therapy. This channel is focused on helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and medications. Be sure to subscribe and hit the notification bell so that you don't miss any valuable tips that we put out every week. So let's get into it. Here are 2 tests that you can do on your own to tell if you've got a hip muscle strain. Now in standing, what you gotta do here, so stand up. You're gonna be thinking about your hips and focus on the one that is bothering you. I'm gonna pretend that it's my right side right here. So if in standing, you twist all the way, keep your feet planted, and you're gonna twist as far as you can. Twist to your back, twist to your hips, twist your knees, twist everything. See if you feel any trouble in there. Now go the other way, twist all the way the other direction. If you feel stretching or pain or discomfort that is present on one side, but not the other side that isn't bothersome. It might be in the front of the hip, it could be on the side of the hip, it could be in the groin area. If you feel any discomfort that's different on the hip that is hurting you versus the one that's not, that's a sign that you might have a hip strain. Now the other test I want you to do to test for hip muscle strains is sit down and move your leg all the way out and then go all the way across like you're gonna cross your legs. And if you feel some stretching in muscles out here in the front or on the inside, then you might have a muscle strain as well. Now, when you go all the way out, you might need to stretch out your knee. That will tension the muscles just a bit more to get the full effect. But generally, where you'll feel the problem if you've got a hip strain is not right in the front of the hip, but more so superficial. It's more closer to the skin around the groin area and around the outside of the hip, occasionally on the front of the hip, but it's not as frequently on the front of the hip. The front of the hip is more hip arthritis problem. So the 2 tests that I want you to do for hip arthritis, one, you might have to take some time to do this, or you might already know the answer. If you have pain in that hip with the first few steps when you wake up in the morning, or if you've been sitting for a while, like typically more than an hour, sometimes it doesn't even take that long, sometimes 20 or 30 minutes. If you've been sitting for a while and then you go to stand up and walk and you feel like your hip is a little stiff and it takes a while for it to warm up and free up and then act normal again, that's a sign that you've got either beginning arthritis or you've got full-fledged arthritis, especially if it hangs out like that for a while and it's consistent. The other sign that you can look for to determine if you've got hip arthritis or the beginning signs of hip arthritis is go back to sitting, and if you turn your foot all the way inwards like you're gonna cross your foot over your leg and it just doesn't go as far, or it causes some pain right here in the front of the hip, that's bad. Also, if you go out all the way, and this tends to be the worst one, if you go out all the way and it kind of bites you on the inside of the hip, and you try it on the other side, if it feels different on the other side, then you definitely are starting to develop a hip arthritis problem, or you've already got hip arthritis. And the other telltale sign, like I was saying earlier, is just pain in the front of the hip. If that's a consistent spot, you tend to get pain right here in the front of the hip area, about where the hip joint would be, the ball and socket joint of the hip. That's a common referral pattern, or the place where the pain shows up when you've got a hip joint, a hip arthritis problem. I'm going to talk to you next about how to begin to address the 2 problems, how to go about a treatment plan so that you can resolve the 2. Now, if you've got a hip muscle strain, this is the better issue to deal with because it's kind of what will lead into hip arthritis. A hip muscle strain usually means that there's a muscle imbalance. Those groin muscles or the outside hip muscles will become overactive because they're being used too much as a result of other muscles being weaker, usually the glute muscles, oftentimes also the abdominal muscles, the abs. If those glute muscles and ab muscles aren't as strong as they should be, the hip flexors will be used more often, and they are not supposed to be stability muscles for your hip. They're supposed to be mover muscles for your hip. Your glutes and your abs serve more as stability muscles for your hips. So if those glutes and abs aren't doing their job, then those hip flexors kick in more frequently, more often, and it's just a matter of time before those hip flexors get strained or pulled. Oftentimes they get pulled or strained whenever you do something a little more aggressive, like if you haven't exercised in a while and then you go to start exercising, or if you go to pick up something really heavy that you don't usually pick up, say you're moving furniture at home, or you start weightlifting, or pick up a kid that you don't pick up, something of significant weight relative to what you're used to doing, that can set off that hip flexor strain. It can also make you pull your groin. Running is the more common associated injury with a pulled groin. Or also walking. If you haven't been walking for a while and you begin to walk for exercise, if you push yourself too hard, it is possible to start to strain or pull a groin muscle. Now, arthritis typically develops when there's been a long-standing muscle imbalance. Now, the interesting thing though is people that have arthritis have the same muscle imbalance that sets up a hip muscle strain, but oftentimes they don't have a hip strain. I hear it consistently from patients that they'll say, all of a sudden I got hip arthritis. I woke up one morning, started getting stiff, and I had been getting stiffer. Muscles never really bothered me. I could usually walk. It'd just take me some time to warm up in the morning. Finally went to the doctor to do something about it, and they x-rayed my hip, and I have arthritis in my hip. Having never pulled a groin muscle or a hip flexor muscle, they never really went through a hip muscle strain. They just began to have hip arthritis issues develop over time. They both have the same root problem, which is that muscle imbalance, typically weak glutes and weak abs, but they present differently depending on the individual. Some will get the hip strain, some will develop arthritis over the years. If you're looking to fix your hip problem, whether it's hip arthritis or a hip muscle strain, go check out our video covering the top 5 glute exercises. It's linked down in the description below. And drop a comment on here. Let us know if you thought that you have more of a pulled hip muscle or if you're developing more hip arthritis. And I'd appreciate it if you gave our video a like if you thought this was helpful for you. Don't forget to subscribe and hit that notification bell so that you can get helpful videos each week whenever we put them out. Thanks so much and have a wonderful day. Bye-bye.